So in this stage of our rehab program, we're going to perform a joint mobilization of the scapula. This is also known as a scapulothoracic joint mobilization. So before we do this, we're just going to measure a little bit of a range of motion and assess the limitations. So we're going to have him do, our patient on his injured arm, we're going to have him do a little bit of shoulder flexion, lifting his arm up as far as he can. About there. Okay. Come back down. And then I'm going to have you bend your arm, and I want you to externally rotate, so go back as far as you can. Okay. All right. So now that we have this assessed, we're going to have our patient sidelined, so we'll ask our patient to move to the side. You want to give them a pillow so they can be comfortable while we perform this mobilization. First thing we're going to do here is find the scapula, the medial borders, inferior and superior borders of the scapula. And what we want to do is just mobilize the scapula in the direction that they're having limitations with. So in this case, if let's just say our patient here is having problems moving lateral, I could come around the scapula border, possibly even cupping, using my fingers, and I'm just going to perform a joint mobilization of the scapula there. So this could be done in multiple directions. Again, we could come under the inferior angle, and we could move the scapula in the directions that our patient is experiencing limitations with. This is going to be done 6 to 8 mobilizations a minute for 2 minutes. This shouldn't be a motion that's super fast, it should be slow. You also want to inform our patient that they're going to experience maybe some discomfort, but they shouldn't be painful. If it's painful at any moment, you should terminate the mobilization.
All right, so today we're going to be working with our patient who has multidirectional shoulder instability. So we're going to be doing isometric holds and external and internal rotation to start increasing their dynamic stabilization of the shoulder. So I'm going to have my patient put the towel in between his arm, and he's going to go up against the wall. We're going to go at 90-90, and he's going to press into the wall, keep an isometric hold for at least 6 seconds, and then rest. We're going to be doing at least 3 sets of 10 with the 6-second holds, and this is just going to increase his external rotation. The bolster here has a purpose because this puts our patient into the scap plane, which is going to be good and ideal for multidirectional instability. All right, for this is going to be internal rotation of the shoulder. So my patient's going to come up against this table. This also can be performed in a doorway, but if you have something that's similar, we can use a corner of something. And he's going to be putting isometric pressure and internal rotation and holding for 6 seconds, just like external rotation. These exercises should be pain-free for our patient. If they were painful, we would stop and go back. Also, we would want to do these again for 3 sets of 10 reps.
So for our second phase of rehab, we're going to be specifically targeting proprioception. So the main emphasis is going to be having our patient regain their awareness of their arm in space, essentially. So what I'm going to have them do is have their eyes closed, and I want them to try to stabilize the best that they can as I provide different multidirectional forces. So this exercise, if there is slight discomfort, that's okay, we're okay to continue. But if it becomes too painful where they can't hold it and can't continue, that's not what we want. Out of a pain scale from 0 to 10, we don't want them exceeding anywhere past a 4. So we're gonna hold that there. Our dosage is gonna be for 3 sets of 30 seconds, and I want them to hold as much as they can. Ready? Hold it. So I'm just going back and forth in different directions. And if I see that it's too hard for my patient, maybe I'll lighten up my load. And if I see that it's too easy, I could increase it or even add a weight to it to further increase the stabilization.
Alright, so for this exercise, we're going to be doing wobble board push-ups with emphasis on retraction going down and then protraction coming up in the stance of the push-up. So I'm going to have my patient stabilize on the wobble board. You can start in a kneeling position and progress to a normal push-up, but he's going to come down, squeeze back here for retraction of the scaps, and then come up and focus on protracting the scapula out. We want to strengthen the dynamic stabilizers of the shoulder He's gonna do this for 3 by 10 reps. We want to make sure with this exercise that our patient isn't experiencing any painful symptoms such as impingement in the anterior shoulder, or if we want to evaluate the posterior aspect as well. If our patient is experiencing any symptoms, we want to regress to a more stable surface or consider other exercises.
So for this exercise, it's going to be part of our functional section of rehabilitation. So what we're going to be doing is mimicking as if our player is going up for a block, but adding resistance to external rotation and actively having our patient retract the scapula, and then they're going to go through a range of motion as if they're going to block. So we're going to have you come over here, we're going to have you come around, take a few steps, jump up for a block as I throw the ball to you. So first we're just going to have the patient practice and go through the range of motion. So you're going to be running up, actively externally rotating, just like that. Yeah, perfect. So now we're going to add an additional force by using the weighted ball. Ready, go. So as mentioned before, this would be a good exercise to maintain that external rotation, activating those rotator cuff dynamic stabilizers, as well as keeping our scapulas retracted, so incorporating scapular stabilizers, and then we add additional force with this weighted ball.